Good day, everyone. I'm Ethan, moderator for this webinar. Welcome, everyone, for today's webinar 2023 CPT Evaluation and Management Important Code and Guidelines Changes. I would now like to introduce our presenter for today, Kate Gilman. Kate has almost 2 decades of experience in the healthcare industry. She is an expert coder and compliance officer and trains healthcare providers all over the country. I would now like to hand over the floor to the best speaker of billing and coding. Over to you, Kate.
Hi, everyone. Thank you so much for this generous introduction. Once again, everybody, my name is Kate Gilman. I am a certified professional coder and certified compliance officer. I'm also a co-owner of 2 medical consulting firms, Medical Business Partners and Medical World Solutions. I really appreciate conference panel for asking me to present today's webinar on 2023 E&M coding changes, and I really hope that you will find this presentation helpful. Without further ado, we have a lot of goals. We have to review deleted codes for hospital observation services, review revised codes for hospital inpatient and observation care services and guidelines, review deleted consultation codes, review revised emergency department services codes and guidelines, review deleted codes for nursing facility services, review revised codes for nursing facility services and guidelines, review deleted domiciliary, rest home, or custodial care services codes, review deleted codes for home or residence services, review the guidelines that were implemented for the E&M codes in 2021. Now, this is just a summary of the E&M codes performed in the office of what we have reviewed. For hospital observation services, the codes for observation care discharge date management, for initial observation care, and for subsequent observation care, all of these codes have been deleted. Instead of 99217 for discharge code, they now want you to use the hospital discharge codes, 99238 for 30 minutes or less, and 99239 for 30 minutes or more. Instead of 99218, 99219, and 99220, which are the initial codes, they want you to use the hospital inpatient care codes. So 99221, 99222, and 99223. Instead of the established codes for observation care, 99224, 25, and 26, the new requirement is for you to use the subsequent hospital care codes, 99231, 99232, and 99233. For 99221, so the new requirement for this initial hospital inpatient or observation care code is the same as we reviewed for the in-office visit. For 99222, it is for initial hospital inpatient or observation care, same thing. 99223 for initial hospital inpatient or observation care. For subsequent visits for inpatient or observation care now per day, same thing. For 99232, for subsequent hospital inpatient or observation care per day, same thing. For 99233, same thing. For 99234, for your hospital inpatient or observation care for evaluation and management of a patient, including admission and discharge on the same date. For 99235, to document the hospital inpatient or observation care for evaluation and management of a patient, including admission and discharge on the same day, same thing. For 99236 is for hospital inpatient or observation care for evaluation and management of a patient, including admission and discharge on the same day, same thing. For office or other outpatient consultation codes. So 99241 was deleted altogether. 99242, so it's an office or other outpatient consultation for a new or established patient. For 99243, this is for a consultation code for a new or established patient. Again, history, physical exam have to be medically appropriate and documented. For 99244, it's to bill for an office or outpatient consultation, again, for a new or established patient, which would require medically appropriate history and physical exam. For 99245, you will like this even better if you're billing based on time, because the prior requirement was 80 minutes. So this is a pretty huge change. For inpatient or observation consultation codes, just like it was for 99241, 99251 was deleted. 99252 for level 3, this would be your inpatient or observation consultation. For 99254, it's for inpatient or observation consultation for a new or established patient. For 99255, this is your inpatient or observation consultation for a new or established patient, which requires a medically appropriate history and exam and a high level of medical decision-making. For nursing facility service codes, these are the codes to report evaluation and management services to patients in nursing facilities and skilled nursing facilities. So for these, 99304, initial nursing facility care visit per day. For 99305, this is for initial nursing care per day. For 99306, it's for initial nursing facility care code per day for evaluation and management of the patient. 99307 is your subsequent nursing facility care codes. For 99308, for subsequent nursing facility care per day. For 99309, it's for subsequent nursing facility care per day for evaluation and management. For 99310, this is for your subsequent nursing facility care. This is for high medical decision making, very important. For nursing facility discharge services, use these codes, 99315 if it's 30 minutes or less total time spent on the date of encounter, or 99316 if you spend more than 30 minutes total time on the date of the encounter. 99318 was deleted altogether, so they propose for you to use 99307, 08, or 9 and 10 instead. For domiciliary, rest home, or custodial services, all of these codes, 99324, 25, 26, 27, and 28, they were all deleted. All of them were deleted. Please make a note of that. They're no longer valid codes. So what are these services for? For private residence, temporary lodging, short-term accommodations, assisted living facility, group homes, and residential substance abuse treatment facilities. So 99341, it's to report your home or residence visit for the evaluation and management of a new patient. For 99342, the time requirement hasn't changed. 99343 was deleted altogether, and instead they propose for you to use 99341, 42, 44, 45. So for 99344, you would use this for home or resident visit evaluation and management of a new patient. For 99345, this would be for your home or residence visit for evaluation and management of a new patient. For 99347, this would be for your home or residence visit for evaluation and management of an established patient. For 99348, this would be your code for evaluation and management for an established patient. For 99349, we're looking at the home or residence visit for evaluation and management of an established patient. For 99350, here's another big change for prolonged service with direct patient contact. 99354, 55, 56, and 57 were all deleted. Use 99358, use 99359 for each additional 30 minutes. This is an important time chart. Prolonged clinical staff service codes, 99415 and 99416. 99417 would be used for prolonged outpatient evaluation management service time with or without direct patient contact. 993X0. So this is the reference page. It's important to understand that the change has come. Please make a note of it. Again, thank you everyone for attending today's webinar. We covered a lot of information. There are a lot of changes that happened. Good luck with everything, and thank you so much for giving me an opportunity to present this topic today.
Just our opportunity to have you with us. So everyone, that is it for the session. You may all disconnect now. You all have a great day ahead. Bye-bye. Take care.